At least 1,900 people have died from the flu nationwide this season, including 3 children. The CDC says that 2 of those children's deaths were reported in just the last week. Here are the details.
At the DC Public Health Lab, doctors are busy testing diseases that could become a public health concern.
The really only time that people see us is when there's a public health emergency.
Dr. Jocelyn Hauser is the director. She says doctors' offices and hospitals around the country send them swabs collected from patients.
We receive those samples and log them into our information system.
Those results are then sent to the Centers for Disease Control and Prevention. This year, the CDC is particularly concerned about growing cases of influenza. The latest data released Friday shows there have been at least 4.6 million flu cases so far this season, 49,000 hospitalizations, and 1,900 deaths in the U.S. alone. The dominant strain causing the surge in illnesses is subclade K, a mutation of influenza A.
We think that this clade K virus is evading population immunity, meaning more people are susceptible to infection.
While doctors in the CDC say the best protection is to get the flu vaccine, Johns Hopkins University professor Andrew Pekosh says this year the shot may not be enough.
It has mutations that may allow it to evade some, but not all, of the influenza vaccine-induced protection.
As millions of people prepare to travel and gather this week for the holidays, there's growing concern illnesses may spike, and cases are surging around the globe. Children, adults 65 and older, and those with underlying medical conditions are particularly vulnerable to the flu. Medical experts are urging everyone 6 months and older to get the flu vaccine.
Director of the National Economic Council, Kevin Hassett, says the U.S. will see the biggest refund cycle ever in the history of America. Joining us to discuss is Daniel Lacaille, chief economist at Tress's hedge fund International Finance.